Hello, everyone, and welcome to the first press briefing of 2021. I'm Donna Bush. I'm so glad that you could join us today on our various channels as well as live on Radio Cayman. We welcome our panelists, starting with His Excellency the Governor, the Honourable Premier, as well as the Minister for Health, the Honourable Dwayne Seymour. With us in studio are the Chief Medical Officer, the Medical Officer of Health, the Director of HMCI, the Sign Language Interpreter, and members of the media. We begin with a prayer from Mr. Noel Wallace.
Great is thy faithfulness, Lord, unto us. Heavenly Father, we come to you today with hearts of gratitude for sparing us from the ravages of another storm, Hurricane Delta. We celebrate not in pride, but in humility, because you are a merciful God. We pray protection and safety of those in its path. Once again, Lord, our leaders meet to inform us and offer course of action to keep us all safe from this pandemic. Lord, give our leaders wisdom in their decision and courage in their duty. May we as citizens be disciplined and responsible in playing our part in practicing all COVID protocols as set out for us. We pray especially for those in quarantine to exercise complete discipline, to wait out the full period of quarantine before any social contacts, for the health of all our people and the good of these islands. Lord, we pray for all those who are discouraged and fearful at this time, for those in need of daily sustenance. God, you are Jehovah Jireh, the Lord our provider. You are Jehovah Rohi, the Lord our shepherd. You are Jehovah Nisi, the Lord our banner. You are Jehovah Shalom, the Lord our peace. God, we call on you in these tough times, for you are the waymaker, problem solver, lifter of burdens, and healer of diseases. Hear our prayer, dear God. Let our cries come unto you, for we pray this in the mighty name of Jesus, our Lord and our Savior. Amen.
And thank you, Mr. Wallace. As we go to our panelists, we'll begin today's briefing with the Honourable Premier, followed by His Excellency, the Minister of Health, and then finally Dr. Lee and Dr. Williams Rodriguez. Premier McLaughlin.
Thank you, Donna. Happy New Year, everyone. Good afternoon, and thank you for joining us on this momentous occasion. As you can see, I and the rest of the panel are doing quite well, having received our COVID jabs at the HSA this morning. I have to say the sight around my vaccination is a bit sore, but that is the case in 80% of instances. Once again, I assure the public that the vaccine is safe. We did this because it is our duty to do so. We're also leading from the front to encourage everyone living here to take the vaccine. It is my firm belief that the vaccine is the only way out of this pandemic, not just for Cayman, but for the world. If we all do our duty and play our part by being vaccinated, we should be in a position by the end of March to have immunized enough of our residents for Cayman to resume an even greater sense of normalcy, to be able to travel much more freely, and to allow people into our country without too much trepidation. The vaccine has been a long time coming. Well, I suppose not so in the context of other vaccines, but the year or so that it's taken to develop it has seemed like 10. I am grateful to the Governor and his staff, as well as the United Kingdom government, for working with our government to arrange for the free doses of the vaccine. The relationship which we have with the United Kingdom government is paying massive dividends. I will leave the specifics of how the vaccination program will be given out to the Chief Medical Officer, but I will tell you that the order in which the vaccines will be delivered will help to ensure that Grand Cayman, Cayman Brac, and Little Cayman are safer. There is a nurse from Public Health from Cayman Brac here this week learning about the vaccine, and she will return to the Brac with the jabs on Saturday. We became concerned about the COVID-19 virus in January, and my government, together with the Public Health and the Health Services Authority, began meeting and setting out a plan that would keep us safe. Indeed, we have always said that our primary objective would be to save the health and lives of our people and residents. We did this by first starving the virus of new hosts, slowing transmission, and eventually stopping transmission altogether. We always knew that the stage we are at now is essentially a holding pattern while we waited for the vaccine. The vaccine is here now, and we have to collectively once again come together to do the right thing and get vaccinated and protected against the virus. Every time someone thanks me for the leadership that we provided over the last year as we took the hard decisions and fought off COVID, I remind them that the success was due to all of you who did your duty, made sacrifices, and followed the guidelines that government laid out. It was the collective act of everyone who lives here and who fought to save the health and lives of our families, friends, and communities. I remember the doubters saying publicly that I and the government were deranged because we would never be able to eradicate the virus in the community. They doubted the fighting spirit and the good sense of the Caymanian people to overcome the virus. I never doubted that the people who live here and who truly love this place would stick together and win. Today and going forward, we have this opportunity again with this vaccine. But I'm afraid that the doubters are again raising their heads and creating unnecessary fear and concern around the safety of the vaccines. My people, we did not let the doubters win last time, and I implore you to not let them win this time. I, the governor, the minister, and other elected members, as well as senior doctors, took the vaccine this morning because we know it is safe and we know it is the right thing to do. We know the hardships we have faced because our borders have, for the most part, been closed for the past 9 months. Today, everyone coming here must be quarantined at not insignificant cost for 2 weeks, not to mention the inconvenience and the challenge of being confined for that length of time. They must be tested on arrival and again before they can leave quarantine. This is not a process that we can keep up indefinitely. Our borders cannot remain closed forever, and we will not be able to maintain the bubble that we have created indefinitely. This vaccine is our best hope in the long term to continue protecting health and life for Cayman and the world. Those of us who can should take the vaccine. Last year was a tougher time than any of us can remember, and we are not out of the woods yet. A new strain of the virus, actually 2 new strains of the virus, that are much more infectious is an additional challenge. As a country, we have come through the worst of this crisis, but we now need to provide everyone the best chance possible to maintain the gains that we have made. To do so requires us to take the vaccine and protect ourselves, protect our families, and protect our community. And in doing so, we will also protect our way of life and help get back even more of the life we once knew. As we face 2021, let us do so with a proud self-confidence that we can come back stronger. But to do so, we will require all of us to take the vaccine. It was our collective action and our sense of duty and responsibility that brought us to the position we are in today. And it will take a similar resolve and unity of purpose in taking the vaccine to deliver us the rest of the way.
Thank you, Premier McLaughlin. Your Excellency.
Thank you very much, and good afternoon, everyone. It's Pleasure to be back with you again. It is really excellent news that we're already rolling out the vaccine in Cayman, and we were the first UK overseas territory to receive supplies. I was pleased to be invited to take it today. Very straightforward, and I feel absolutely fine. Despite the highly challenging COVID-19 situation in the UK is fully committed to supplying vaccines to the overseas territories. Cayman, Bermuda, Turks and Caicos and Gibraltar are receiving the Pfizer-BioNTech vaccine because these overseas territories have the necessary very low temperature cold storage facilities. Other overseas territories are likely to get AstraZeneca Oxford vaccine, as that's much easier logistically, but we may also get that one as part of future supplies. So it's really good news that the first delivery of 10,000 doses is here and rollout is underway, and everything is going well so far on the trial run. I expect the next batch to arrive on one of the next BA flights, but that isn't confirmed at the moment. And I just want to emphasize that take-up of this vaccine in Cayman and the overseas territories is really important, because these vaccine supplies are very precious and still in short supply. So we want to see a strong take-up of the vaccine in our islands. And as the Premier said, the vaccines are being provided at no cost to the overseas territories. This batch alone cost over £200,000 UK pounds, which excludes freight costs. I think it's a really strong signal of support from the UK to the overseas territories, which are a really important part of the UK family. And as the Premier said quite rightly, it shows the value of a very constructive UK-Cayman partnership. In the UK, the programme for vaccinations began on the 8th of December with the Pfizer vaccine, and the AstraZeneca rollout began on the 4th of January. In the UK, over 1.5 million people have already received a vaccine, and over 15 million people globally have now had a vaccine. The AstraZeneca one is much cheaper and much easier to transport. I believe its development is a major success for British science, and it's likely to be a key part of the global rollout. The Pfizer and AstraZeneca vaccines approved for use in the UK and the British overseas territories have met strict standards of safety, quality and effectiveness set out by the UK's Independent Medicines and Healthcare Products Regulatory Agency, the MHRA. The regulator credited the relatively rapid approval to its rolling review process, which allowed it to analyse the data as it received it. Many other countries have now approved the Pfizer vaccine, and India has approved the AstraZeneca one. So vaccines are already being rolled out to millions of people with no serious side effects or complications. A very small number of people did suffer an allergic reaction, but they knew they suffered allergies and were prepared with medication to counteract the reaction. I think, as Dr. Lee is going to set out later, unlike in the UK, we will be giving people here 2 doses of the Pfizer vaccine 3 weeks apart. Most people will then be protected against coronavirus having had both doses of the vaccine, but a lot of immunity builds up in the first dose. There is about a week after the second dose until full immunity builds up, which is 95% successful. So it's a really strong vaccine and a successful vaccine. Having the vaccine, of course, benefits our whole community through herd immunity. If enough people are vaccinated, it is harder for the disease to spread to those people who cannot have the vaccine. So I encourage everybody, as the Premier has just done, to take the vaccine when you are offered it. This will help us as a community to begin to develop herd immunity and enable us to safely reopen the islands and get back to business as usual. Now, it is understandable that some in our community have concerns, and I respect people who have genuinely reasonable concerns. But please look at information from trusted official sources to form your view. I believe that when looking at the facts around the vaccine objectively, the case for taking it is very strong to protect yourselves and others in the community, particularly our elderly and vulnerable. And please do not be taken in by some of the frankly quite far-fetched conspiracy theories doing the rounds about vaccines. There is a lot of misinformation on social media. The Cayman Government Islands website is an excellent source of objective and clear information. Just a quick word on vaccines more generally. Vaccination has a long and successful track record. It's the most important thing we can do to protect ourselves against ill health. They prevent up to 3 million deaths worldwide every year. Since vaccines were introduced in the UK, diseases like smallpox, polio and tetanus that used to kill or disable millions of people are either gone or seen very rarely. Other diseases like measles and diphtheria have almost been eradicated since their vaccines were introduced. So I just want to end by sort of encouraging everyone to take the vaccine. I believe it is the genuinely Cayman-kind thing to do for everybody in our community. Two other brief points before I conclude. One, just to say that returning travellers remain our greatest risk, and I encourage all returning travellers to follow closely all the guidelines around self-isolation and quarantine, because it is so important for the health of everyone on these islands. So far, we are managing this extremely well, and I want to thank the Deputy Governor, Dr. Tasha Ebanks, and Travel Cayman, who are doing an outstanding job around the clock to keep us all safe. And as I said, that system we have is working, and we should be proud of where we are as a country in dealing with COVID. And then finally, I just want to congratulate Ms. Carolyn Powell, our sign language interpreter, who received very recently a very well-deserved certificate and badge of honour. And she's now blushing, but thank you very much, Carolyn.
Congrats, Ms. Carolyn. Thank you, Your Excellency, Minister of Health.
Thank you, Donna. Good afternoon, Caymanians, residents alike, and all viewing overseas. Happy New Year to you all. As you're aware this morning, along with the Premier, Governor, the Chief Medical Officer, and others, took the COVID vaccine. I look forward to the full rollout of our national vaccination program to the communities across all three islands. I feel blessed to begin 2021 with such good news for all the people in our islands. I want to thank God for allowing us to get through the height of this pandemic and saw us to this point where we could receive vaccines. And as said in the 3 John 1:2, their friend or beloved, I pray that you may enjoy good health and that all may go well with you, even as your soul is getting along well or prospers. And I know some are having anxiety out there and feeling uneasy about the vaccine, but Isaiah 41:10 says, "Fear not, for I am with you. Be not dismayed, for I am God. I will strengthen you. I will help you. I will uphold you with my righteous right hand." I want to thank BA, British Airways, and the Governor and his staff for continuing the air bridge that was able to bring the vaccines in such a delicate manner. These vaccines are not easy to ship, the Pfizer vaccines. I want to thank all the airport staff that we saw out there on arrival, the HSA staff especially, who met the plane and transferred the vaccines to the cold storage freezers. All persons who work hard to make this day possible. I can say that this morning the HSA staff were very, very professional, and they ought to be commended. They ought to be commended. Although the vaccination for COVID-19 is voluntary, I urge as many of you who are able to also become vaccinated in order to best protect yourselves, families, and the wider community. As of yesterday, the worldwide count had reached a staggering 86.8 million cases and a heartbreaking 1.9 million deaths around the world, sadly. According to Bloomberg, as of the 6th of January, almost 16 million doses of COVID-19 vaccine in at least 37 countries have already been administered. This speaks volumes about the safety of the approved COVID-19 vaccinations, We can all agree it is a massive undertaking to protect the entire globe, and we have to keep doing our part here at home to fight this deadly disease. I am proud we have joined this life-saving campaign with the island's first batch of COVID-19 vaccines being administered. Having taken my first dose this morning, I can attest to the safety of the vaccine and confirm that I am feeling fine, and I ask everyone in our community to come forward when it is open to your category. Although the vaccine is not a cure-all, it is a light at the end of what has been a very long, dark tunnel for so many people. In a light moment, I also felt safe in terms of the vaccine, knowing it was a preferred brand of many in Pfizer that makes the popular brand sildenafil that gives a new purpose. And some may ask, what in the world is sildenafil? I won't say the actual word, but they would have to Google that. Though the first batch of vaccines have reached our shores, we cannot become complacent as we begin taking the vaccines here. Unifying with the rest of the world in the fight, we must still continue to practice prevention measures. Remember to check www.gov.ky/coronavirus for updated safety guidance. On the site, you will also find our FAQs on the vaccine with lots of helpful information you can discuss with your loved ones and families in your decision making. There is also a video with Dr. Lee on the page and our CIGD TV channel. Many of the concerning myths around the vaccine you'll be able to see there. Lastly, we should all, if we are able, get vaccinated and do our part in the fight to help rebuild our economy, to open our borders, to travel freely once again, and of course, to spend time without worry, without the elderly and the vulnerable in our lives. I want to say in my effort, as I've done in the past and the first half of this, to try to get everyone to try to take the vaccine. There's not only Caymanians living on this island, we have many other persons living on this island that we welcome. But I want to say to you, be safe and take the vaccine. In Tagalog, that is lictas como un vacuna. In Spanish, that is estar segura tomar la vacuna. In the local colloquial Caribbean speak, if you don't want a tanayayad, take the vaccine. I thank you and God bless.
Thank you, Minister Seymour. We now call on Dr. Lee.
Good afternoon, everybody. I expect you're waiting for some results, so I will give them as per usual. There are 199 COVID-19 tests to report today, of which 3 are positive in travellers and they are asymptomatic. That brings the total positive in the Cayman Islands to 357. Of those, 310 have recovered. There are 11 people that remain asymptomatic and 34 symptomatic. Currently, there are 167 people in government facilities and 934 under the home quarantine program. I thought it would be helpful just to start by advising of the National Vaccination Plan. I understand that many people are wondering what this is. It has been shared and it is available on the www.gov.ky/coronavirus website. Nevertheless, it's good to share it here with you now. Stage 1 has actually been drawn up into 3 groups. Group A is for residents and staff of institutional facilities, individuals aged 70 and over, healthcare workers and first responders, and all frontline staff dealing with incoming travellers. Group B is for adults 60 and over or with the relevant health status. and Group C is for workers essential to government continuity. Some people may be wondering why we have the subgrouping, and it's essentially because when our first tranche of vaccines arrived, that is not enough to address all of stage 1, which is why we've prioritized people over 70 in the first grouping, because we know that age is a very strong predictor of poor outcome from COVID, which is why that recommendation for age priority has been given around the world. In stage 2, anyone aged 16 to 60 with relevant medical status, those living at home with persons from stage 1 of the program, and essential workers, teachers and school staff. In stage 3, we then move to opening it up to anybody who is eligible. That's for the Pfizer vaccine, would be people aged 16 and above who have not already received the vaccine. And it would begin with people aged 50 and above because of that age priority. You'll have heard already today that I had the vaccine along with other people in this room, and I'm delighted to be standing here feeling no ill effects whatsoever. And I would encourage everybody to take up the vaccine. It's a wonderful gift to the world that we have this so quickly in the battle against this really horrible disease. And I encourage you to do so. Happy to take any questions, Tom.
Okay. I'm going to now open the floor up to members of the media who have any questions for our panelists as well as for Dr. Lee. We're going to begin with, who wants to go first? April from Radio Cayman.
Thank you, everyone. I think this might be a Dr. Lee question or Dr. Rodriguez, so I'll ask first and then we can figure out where we need to go. A lot of the questions that people have sent to us at Radio Cayman had a lot to do with concerns about some of the fine details around, I have allergies, how do I know if it's okay to do this or not? Or if there are people with lots of different kinds of allergies, are they more susceptible than others? A lot of these questions are very specific, but they're looking for reassurance and information. Dr. Lee, what would you advise folks to do?
I think the most important take-home in this particular discussion is the fact that nearly, as Minister has said, nearly 16 million people have had the vaccination. And so even in the very short time that the vaccination has been available to have, we've already got a tremendous amount of experience because allergic reactions are very likely to happen at the time or very soon after the exposure to an allergen. So in fact, since the very early adverse reactions in 2 people, the guidance has changed from the MHRA in the United Kingdom. And I'm going to read it now because it's good to get it exactly correct. The MHRA now advises that people with a history of anaphylaxis to food, an identified drug or vaccine, or an insect sting can receive the COVID-19 vaccine, as long as they are not known to be allergic to a component of the vaccine. The components for the Pfizer vaccine are available on the website. They're largely chemical-based. It's not something that they don't have egg, for example, in them. So those can be seen and read. For any individual, it's really important that you would speak to your own healthcare practitioner before you go forward if you have any queries, and then again with the relevant healthcare professional who'll be providing your vaccine at the time, who will all know the information that I'm presenting to you now, because that's part of their training and in order to give out the vaccines. I would just clarify a little bit, because the British Society for Allergy and Clinical Immunology, respected organisation, have advised that individuals with a history of immediate onset anaphylaxis to multiple classes of drugs or an unexplained anaphylaxis should not be vaccinated with the Pfizer-BioNTech vaccine, and the AstraZeneca vaccine can be used as an alternative, if not otherwise contraindicated. Sorry for the lengthy answer, but I appreciate that this is a question a lot of people are asking.
So if I can summarize, and please correct me if I've done this incorrectly, you should be talking to your doctor before you take the vaccine.
If you have any questions that you feel need addressing, for example, you have a lot of different allergies and you're not sure yourself, then yes, get clarification from your healthcare provider.
And one other question, not quite related, but somewhat. If someone has had COVID-19 and recovered, do they still need to get vaccinated if it's offered to them or available?
The answer is yes. Some international public health bodies are saying to wait for 6 months because it's likely you're going to have your own immunity. Others are saying just go ahead and have the vaccination. So there's no harm in you taking the vaccination. And we never know. It's a much more defined thing when you have a vaccination as to what your response will be, as it's been measured and quantified. When you have an infection yourself, we're less able to know, so the vaccination is more likely to give you a stronger and longer immune response.
And does a vaccinated person present a risk if they come home to an unvaccinated family? There's been some discussion about whether I could still carry it. I mean, I assume I could carry it on my hands, but they meant through their systems.
I don't quite follow your question, so I'm going to help a little bit perhaps and say that if you've had the vaccination itself will not cause you to have COVID and not cause you to be infectious whatsoever. However, there remains this question about whether, if you've been vaccinated, can you still carry the infection if you've met somebody who has the infection? And that answer is not entirely clear. It is very likely that you might be able to, which is why many countries will continue to have the requirement for masks and distancing until we know more about that. The answer to that question will only come with a few months and lots of scientific study. You're likely to have a degree of protection, but the amount of protection is not 100% known as to whether you'll be able to transmit an infection, even though you yourself would not get sick or would not show any signs of being sick.
So some of it is still a bit of wait and see?
Yes, it's still not known, yeah.
Thank you very much. I have others, but I'll let some folks come.
Good afternoon, Dr. Lee. First of all, in terms of the rollout, those who will be vaccinated, I know you four have been vaccinated. Are there any special changes that they may need to make for their own personal interactions, or people who they interact with? For example, should they wear masks? Should they social distance? Are there any...
For the people that have received the vaccination?
Yes.
Yeah, no, not at all. The Pfizer vaccine has no live component to it, so you're not going to become infectious in any way.
Okay. Are you able to say how many people were vaccinated today? I know we did 8 this morning, but there were others.
Yeah, in fact, the vaccination program is running right now. So healthcare providers and some patients are currently being vaccinated at the Health Services Authority. And because we just need to start and get on with the process. So they began the process vaccinating their own staff today, and some actually were vaccinated yesterday as well as part of their acclimatization to the use of the vaccine. I don't know the exact number. What we're intending to do, I hope daily, perhaps only weekly, is to give you a count. So on the daily figures that we send out from GIS, because I know I like everybody else, wants to know how many people have been vaccinated. We hope to provide that count to you at a regular basis, and that should be fairly straightforward to do.
Okay, now we got a comment or a couple of comments asking why the politicians are getting the first bit, jumping the line in some cases, because there were a couple of other political figures that got the vaccination today as well.
I think it's incredibly important to demonstrate to the public the confidence that we have in this vaccine. That's why I was there, that's why my fellow senior doctors were there, and that is why members of senior political figures in the country were there in order to demonstrate our confidence in the vaccine, such as the importance of us taking this vaccine. So I don't feel it was a question of priority, it was a question of trying to give people the confidence to say, we're all standing together because we believe this is the right thing for Caymanians to do and for all of the residents to do, and to encourage people to take the vaccine.
Okay, thank you for that. Now, in terms of the UK travel and those who are being allowed in, now the UK has positioned itself giving only 1 dose for this time being. For those who have that 1 dose, are they still being allowed in, or will they be required to quarantine? I'm talking about when the borders open, sorry, to quantify the question. When the borders are reopened, for those who are getting that first shot, will they have to quarantine, or what's the process going to look like for those individuals? Have you gotten that far?
Those regulations haven't been written yet, but it's highly likely that they would say something along the lines of, if I was asked, something along the lines of a valid course, completed a valid course. And a valid course would be two injections for the Pfizer vaccine, for example. Some of the future vaccines may actually only be one injection, so the valid course may only be one. But we haven't quite got there, and there will be discussion before the Cabinet considers any advice that it's provided and then sets out the regulations accordingly.
Now, naturally, people are very excited to be able to, plan ahead to come to the Cayman Islands. A lot of the questions we've gotten were from people who have children as well, 16, people who have allergies. What's the guidance going to be for them, or people who can't take the vaccine but want to come to Cayman?
That, again, is going to be an exceedingly fluid situation. We have a lot of fairly solid thinking behind it. I think I'd prefer not to share it until such time as we have drawn up the plans completely. As we move through this year, we are going to find, I say with great deal of hope, that the numbers of people suffering with COVID around the world begin to drop quite dramatically. And when that begins to fall, that will be a combination probably of us moving out of the winter season for the Northern Hemisphere, and also people having vaccinations. As that falls and the prevalence rate of COVID around the world falls, it's very likely we will revisit all sorts of things, such as the period of time that we have for quarantine for those that might not be eligible to have the vaccine. And Premier has previously said that people who've had the vaccine, a valid vaccine, will be exempted from quarantine. So we will also be able to consider shortening the quarantine period. So all of these things will ease travel and ease travelling with children and so on a great deal. Certainly I recognise that for the tourism industry, people travel as family groups very often. And in that particular instance, again, we will have to think clearly about different approaches to that group, but we may want to consider, for example, and these are all hypothetical, that we have different requirements for people who we know are just visiting and unlikely to do much mixing, and then other families who we know the children are going to return to school.
Okay. Now, in terms of the vaccines themselves, we do have more than one vaccine that is available. Is there any preference for which vaccine would be travelers or even us can take, or is it across the board, whatever vaccine you take, of course, of the approved vaccines?
I think it is going to be the case that the three vaccines that we currently have, and well, actually it's more than that, but because there are vaccines from other countries as well, from China, for example, that a lot of these vaccines will eventually get approved by the World Health Organization, and at that point it'll be all of the vaccines that are approved by the World Health Organization that we would be accepting and encouraging people to use as part of their protection against COVID-19.
Okay, thank you. And earlier today, there was a yellow card that you received and the Premier and Governor received. That's the certification or the checkbox.
Yes, that's just actually the standard World Health Organization, WHO, little vaccination booklet. Mm-hmm. Some of you will already have mine. Actually, my original one was sitting at home in my drawer because I forgot to bring it today, so I had to get a new one. But many of you will have had that since you were children, and that it's just one of those where we're keeping the record. But if you didn't have that, if we run out, because we don't have a limitless supply of those, we do also have a card similar to the cards you've seen, for example, in the US or other places, where we will record the vaccine and give people a written record of their vaccination. So
that would be a separate certificate certifying you have taken the COVID-19 vaccine, or is it just a regular immunization?
It's the regular it's a pretty standard. You could actually put any vaccination on it on the little yellow books. It's not particular. It's not specific for COVID. Yeah.
Okay. I'm going to give someone else a chance, but I still have more questions, especially for the panel. Thank you.
Good afternoon, everybody. My first question, Dr. Lee, where are the vaccines being given to people? Where can we go get one if I was to be over 70?
I think to answer that question, I might ask Dr. Williams to give, because he'll give a summary of how the rollout is going to be and how people can access it, because I think that's where you're going. Is that okay?
Yeah, that's right, because I was
Yeah.
thinking if it's already rolled out today. Yeah, thank you. Thanks, Dr. Williams. But I think I've got more for you in a minute. Thanks.
Yes, good afternoon. So your question, Wendy, was...
Where people can now start getting the vaccine if they're in the right groups.
Okay, yes. So the vaccine, as Dr. Lee has mentioned, we start already giving the vaccine to some groups, mainly healthcare providers from the HSA, but normally from tomorrow morning, we'll start giving the vaccine to those priority groups. We'll start with tomorrow morning at 10:30 a.m. at the Health Service Authority, the flu clinic that is located where the old physiotherapy department used to be. And that's going to be for individuals over 70 years old and healthcare providers from both the private sector and the public sector. From next week, we will start from Monday to Friday in each of the district health center. We're also going to be offering the vaccine at the district health center. We'll continue to offer it at the flu clinic at the Georgetown Hospital. This will include all the individuals that Dr. Lee has mentioned that are on the first phase, which includes 70 and over, the healthcare provider, and also the frontline staff at the port of entries. For Cayman Brac, the Premier had mentioned earlier, there's a public health nurse from Cayman Brac that is currently here in Grand Cayman. She's getting herself familiarized with the service and with the vaccine. She will be traveling to Cayman Brac, back to the Brac on Saturday, and the same Saturday she will start giving vaccine to the public in the Cayman Brac, and on Wednesday it will be given to Little Cayman. We also have organized visits to residential homes and to other institutions on island, and they have been already contacted. Our schedule has been sent to them. Public health nurses from the hospital will visit as well Health City Cayman Island and Doctor Hospital to vaccinate their staff and also any client that they will have there that qualify for the vaccine. Also some private healthcare location facilities, larger healthcare facilities, we will organize trip to them also to give them the vaccine, but they are welcome to come to the HSA every day from Monday to Friday from 10:30 in the morning to 3 p.m. We are asking for tomorrow for the public because I know initially we may get, we don't want to get overcrowded, for individuals from the letters A to D to go from 10:30 to 11:30, E to G from 11:30 to 12:30, H to M from 1:30 to 2:30, and N to Z from 2:30 to 4. Well, do you have any questions?
The next question would be, the HSA will say, okay, we're now ready for this group on a certain date, or do you already know that? Do you already know when you're going to start with Group B, then Group C, and then T, and then Stage 2?
It will depend on the uptake for the vaccine. As you will know, we have a limited amount at present.
So you're going to put out a note, you will
But we
put
will
out a public
definitely
announcement.
constantly put policy announcement with which group can attend.
And I understand it's all walk-in, yeah?
It's all walk-in, yes, correct.
Walk-in, okay, thank you. I think that's it on that one. I think I'm back to Dr. Lee, just to get some clarification on a question that April asked earlier about the situation with regards to understanding whether we can or cannot transfer the virus once we've been injected, but vaccinated, whether we can transfer it or not. Obviously, that information is starting to come from the science community. So can you reassure the public that that will be something that will be taken into consideration about the knowledge regarding the scientific knowledge at that point before we open the borders?
What we are intending to do with the vaccination program is what everybody is intending to do around the world, and that is to provide protection for our most vulnerable. I've described it similarly elsewhere, but we have put up a shield of protection around the island up till now, which includes the quarantine up to now. We now wish to afford this protection to the vulnerable of the community. once those vulnerable in the community have been afforded that protection, that's the time at which Cabinet will consider whether they should ease the travel restrictions that are currently present. It's not really, so I haven't quite answered your question, because the answer to your question, the information may not be available for some time, but that is not currently the plan. The plan is currently to consider opening when our most vulnerable have been provided the protection of the vaccine, and also a lot of the people who will be involved with the travellers.
Okay. Another question, which is probably for the Health Minister, is will there be any circumstances under which bosses, either in the private sector or in government, will be able to force staff to have the injection? So, for example, a private hospital, will they be able to insist that their staff get the vaccine, otherwise they'll get fired? I mean, is there anything under the labour law that can protect staff? Or
It's a good question. I would hope it doesn't happen. Right now, it's not mandatory, and we'll have to continue to monitor the situation and make decisions as we go. But right now, it's not mandatory, and we were very specific about that. But it's a very good question, and I'm sure it's going to come up. I'm sure some employees are going to be put in this position, and I hope that the bosses handled it as professional as possible. I would hope that no one is forced to do anything.
Thank you. As it's still under your remit, I'm going to stick with you, Minister. The situation with the health insurance, we understand that nobody has had their health insurance covered since back in the summer. So that's furloughed workers, people that have been unemployed that used to have a healthcare policy because they were working, who have lost their jobs or their bosses can no longer afford to pay their health insurance. Do we have any solution about that situation yet?
Wendy, I'm not sure if you said no one. No one is covered. I'm not sure it's no one.
Well, the people that were under that scheme that you introduced to protect for those that had lost their policies.
That is still an ongoing dialogue going on with the ministry and the insurance, the healthcare providers. It hasn't been solved as yet, but the amazing thing about it is there's only one or two companies emailing about that situation. That is and we've put out correspondence trying to ascertain information from persons who would take this up once we're able to start it again. And there was really not a lot of people. I don't know why. There wasn't a lot of people that responded to that correspondence. But I'm sure there's a lot of people out there, especially in the tourism industry. It is something that we have just spoke about again on Monday in caucus. It is not off our radar by any chance. There was, I must admit, there were some financial challenges in my ministry, which is being rectified, and within the next 2 weeks we should be able to negotiate forward in a more positive manner, at least financially anyhow.
Thank you for that. Another question is, older people that are here visiting or are property owners that are long-term, they're not residents per se, they're visitors that maybe own property and are here for the long haul, will they have access to the vaccine or not?
Well, yes, but in terms of priority, they would be further down the list. But the objective is to make the place as safe as possible. So that means that anyone who is here, we would want them to be able to avail themselves of the vaccine. I mean, we're very anxious, and Dr. Lee didn't say this, but I know this to be the case. We're very anxious to use up the vaccines that we have as swiftly as possible, because us getting more is contingent upon us demonstrating that we are utilizing them here. The population is very small in the grand scheme of things, and if we can get the take-up that we hope for, it is possible that we can be in a safe place by the end of March.
What is the level that you're hoping for?
Well,
percentage of the adult population?
In my mind, somewhere around 70%.
Yeah, that's about 42,000, 43,000 people.
Dr. Lee, are there any issues about the storage? Are we good for storing because I know it has to be at like 3 billion minus degrees.
I smile only because we have these 3 great freezers, and actually when the vaccines arrive, they're not very big, so we could probably fit them all in one of the sections of one of the freezers. So we're good for storage space. Yeah,
okay. And that goes for getting it to the sister islands as well. We're okay.
Yes. So we always need some redundancy whenever you're dealing with anything so precious as this. So we're pleased to have redundancy in case something goes wrong with any of the freezers. As far as getting them to the BRAC is concerned, it's a more complicated story. Pfizer, the manufacturer, have stipulated that for the stability of this vaccine, it must only make 4 journeys in an iced state before it's put in a proper freezer. And the 4th journey was to get to our freezer. So it cannot make any more journeys in a frozen state to somewhere else. It can, however, be stored at fridge temperature, which is between 2. It's the same as your fridge and my fridge, for 5 days, and is absolutely fine. So we send it in an ice box to the sister islands on a Monday morning, or as it's going on a Saturday, and it'll be good for 5 days. Once it's actually been taken out of the fridge and diluted for use, it can stay up to 25 degrees, so relatively warm for 6 hours. So it's not that unstable, but we just have to. We can't, for example, at the moment, put a freezer in Cayman BRAC and send it there, because that would be another journey. We will have access to more vaccines as time goes on, from either from the United Kingdom, perhaps direct from the manufacturer, which will give us more flexibility, or from our application through the COVAX facility, and then we will have more flexibility in how we deploy these.
Okay, so you're going to have to ship it to places like the District Health Centre at East End or Northside in the amount that you think they're going to need over the next 5 days?
Approximately, yes.
Right, okay, I get that. Right, the only questions I have left are literally relating to the outstanding cases. I'm not sure anybody's here that can help us. There's still, our readers are asking a lot of questions about the outstanding cases of people breaching quarantine that have not been dealt with. Obviously, Skylar and VJ took up all the headlines, but there's 4 other cases that we're aware of that we've heard nothing about, and I don't know, is anybody there able to help us?
I think just to repeat what's already been said, that they remain under investigation, and if that they get to the stage where they go to prosecution, then that will happen, but they still remain under investigation. I think the last press release noted that some of these cases were quite complex and difficult, and it isn't straightforward just to move forward quickly. So there's nothing really further to say on that today.
My final question is probably for the Premier, which is when you're thinking about reopening the borders for tourism in March, April, that time, what are your thoughts at the moment about cruise? Is that still an absolute?
Cruise is not on the radar at all at this stage. I think we would have to be satisfied that the world was a very different place in terms of safety relating to coronavirus before we would even consider having the cruise ships come here, because as they've demonstrated, they are really crucibles for the virus, because of the way people have to live in such confined spaces and in such close contact with each other. So honestly, I don't see cruise tourism resuming with any on any sort of significant level before next year.
In 2022?
I'm making the statement generally, not
Yeah.
just in relation to Cayman.
Do you know, because I think what happened was that there was an official closure of the port, as it were, that ended on the 31st of December, and I'm not sure that there's been any official explanation as to what the actual status now of our cruise and cargo port is. Well, especially not so much cargo, because obviously cargo's open, but the cruise port, there was that you had like the official sort of reopening of the airport in a staged way. I don't think we've had that for the cruise port, so I think people were wondering what the official status of it was.
I'm struggling to try to remember where we are with that, but I'll check. I can't answer the question because.
But you can say categorically that there's no consideration.
Yeah, the cruise ship business is not really within our contemplation at this stage.
I'm done. Thank you very much, gentlemen. Thank you.
Ralph, you have a question? Okay. Okay, please come. Huh? Yeah, let's go ahead. Go ahead.
Good
Ask a
afternoon,
question.
gentlemen, and Happy New Year to you. Just a few questions. Dr. Lee, who can shut-ins contact when they're ready for their jabs? And if someone has a concern regarding taking the vaccines, is there anyone a number that can call to ask information and get feel a level of comfort before they take it?
As far as getting the vaccination itself, it's a walk-up service, so people should feel able to do so, unless they fall into one of the groups where they're particularly vulnerable or immobile, in which case they should contact public health, because it could well be that a service can be taken out to them if they struggle with mobility. For questions, I would again please ask these to be directed to your primary healthcare provider in the first instance, who will probably be able to answer the large majority of questions. If there are any specific issues, I'm sure they will reach out to us. If the questions are more not so individual and related to that particular person, then the public health department may be able to answer the question. There is a leaflet, I'm not sure if you've seen it, about the national vaccination plan, and in there are contact details on the back for the public health service, and essentially the number to ring is 947-3077, or the email address is flu@hsa.ky.
Okay, thank you. Next question. We have got our first shipment of vaccines. Do you anticipate any delay in getting future shipments, or they're on a regular routine to come in?
We haven't, I think, looking at the overwhelming cases of COVID that are being seen around the world, and in particular the United Kingdom, where our vaccines are coming from, we have been enormously grateful and appreciative that we're receiving the vaccines that we have already done, and we're looking forward to the next batch. Looking further into the future, I think actually, to be honest, the availability is going to ease rather than anything else as more suppliers come online and manufacturing increases, but we don't have a schedule as such and beyond the next shipment.
If everybody was to take the vaccine, would you say in about 3 to 4 months everyone should be vaccinated?
It depends how fast they come forward, really. To vaccinate somebody is pretty quick. Public health have demonstrated every year with the flu vaccine that they can vaccinate around 60. One small team have vaccinated around 60 people an hour, and if you think that they are putting in 3, 4, 5 teams per day for this program, you can soon see that each hour they're going to be doing several hundred, and the thousands ramp up very quickly. So it really is a question of people coming forward, and as Premier has pointed out, Governor's alluded to, we really hope that people will come forward and that we can push this vaccination program out as fast as we can, because that will encourage us to receive more vaccines and to get our community to a safe place.
Okay, and one final question regarding the pandemic. In recent days, we've seen an increase in the number of positive cases picked up through screening. Are you concerned about those numbers?
I'm always concerned about positive cases. I see the results come through all the time, and I've seen that the increase appears to me actually to be more related to the increase in traveller numbers, absolutely, rather than as a percentage themselves. Because if you look at each individual flight, I see 100 or 200 results coming through. The individual numbers for the flight don't seem to be jumping. It's rather the fact that we just have so many more people coming through.
And you're comfortable that the quarantine for arrangements that they've been taken care of?
I think we've done incredibly well, and I really, as has been said, thank very much all of the people who work at the ports, Travel Cayman, Dr. Tasha E. Banks Garcia. They've been doing a great job in maintaining our biosecurity in this way.
Thank you, Dr. Lee. Thank you, Donna.
Donna,
Thank you, Dr. Lee. Premier McLaughlin?
I have one other very important announcement to make. From the 14th of January, travelers arriving in the Cayman Islands will need to show evidence of a negative polymerase chain reaction, the PCR COVID-19 test, taken no more than 72 hours prior to departure in order to board their flight. Cabinet approved this measure on Tuesday, which was the day before yesterday, which requires all travelers aged 10 and older to provide negative test results from an upper airway swab. Given the new highly transmissible strain of the SARS-CoV-2 virus discovered in the UK and more recently in other countries, the added testing requirement aims to reduce the potential for any surge of cases in these islands. The government will require that the test be provided in the UK from a UCAS accredited laboratory or the National Health Service, and in the US and Americas worldwide from a JCI accredited lab or an ISO or COLA Commission on Office Laboratory Accreditation accredited lab or National Public Health Laboratories. Airlines will check passengers prior to departure to confirm that an appropriate negative PCR test has been provided and will deny departure to anyone without proof of a negative test. Cayman Islands Customs and Border Control officers will also require documentary proof of a negative test. A paper copy is recommended, but an electronic copy is acceptable. There are more details, which I'm sure people will want and need, which I am not this afternoon able to provide, but a release will be issued by tomorrow, setting out all of those details. The reason why they're not available is some issues are still being worked out. But we felt that it is important that we give people as much notice as we possibly can of this significant change in the requirements. So I would ask everyone to pay attention, very careful attention to the public service announcements that will go out in relation to this, and to the Cayman Islands government website that will provide this information.
Thank you, Premier McLaughlin. Any final questions from members of the press? I believe, Reshma, you had a few questions for the panelists, and then we're going to wrap up. Please come.
May I save the bomb for the last? Just a quick question on the that came through during the press briefing in relation to the pension withdrawals. I know you had said that there would be no extension of that. Have you reconsidered that? Are you looking at possibly reopening pension withdrawals?
No, not at all.
Okay. How far along have you gotten in working out the border reopening plans? We've gotten questions coming in. Do I have to present a certificate for when a certificate of vaccination, that is, for when I'm making my travel plans to come to Cayman? Because people are looking at March, the end of March, to return.
No, we aren't there with vaccinations yet. There aren't sufficient number of vaccinations worldwide to enable us to reach that particular point. In relation to the Cayman Islands, we are looking at a range of things to require once we are able to get enough of our people vaccinated that allow us to start looking with more focus on when we can actually reopen the borders. But we aren't there yet. Today is the first day of the rollout of the vaccination program, so we've got probably a couple of months to get there.
And finally, you just touched on it with the change. Are there any? Are you revisiting the number of UK flights that will be coming in as a result of this new strain? What's the thinking like from government in relation to travel, Cayman, UK route?
No, we're not considering reducing the flights. What we are doing is looking at how we can continue to ensure the safety of the community while allowing the traffic between not just Cayman and the UK, because UK people don't just come to Cayman, they go all over the world. So the strain is in the United States, it's in other places. So what we have to look at, and what we are looking at, is ensuring that we have the measures in place and infrastructure in place to continue to keep this community safe. Therefore, this heightened level of requirements that I've just announced.
Okay, great. Thank you.
April?
Hi again, everyone. The question came from a Caymanian family who's been overseas. Their children are too young to be vaccinated. And they raised the question, what's our thinking, or how are we handling families with young children? In terms of travel, essentially, home or otherwise. The whole family would need to be quarantined, I'm assuming?
Yes, in short. If they if the parents are coming they with the children, then everybody's going to have to be not vaccinated, isolated.
And then another, also a parent, has students who are studying in the UK, and asked if there's any consideration to bumping some of those students up on the vaccination priority list so that it will be easier for them in terms of coming back and forth.
I think you need to look at Dr. Lee.
Hi, Dr. Lee. He's not saying yes.
The very strong guidance we're receiving on that question is that we should continue to maintain our priority groups, and travelling is not a priority group. They will be based on clinical priority and operational priority.
Of course, if we reach the regrettable conclusion that there isn't significant take-up by the priority groups, then other decisions will have to be taken, because we want to utilize these as swiftly as possible. But we strongly encourage the most vulnerable in the community, that is those over 70, those with underlying medical issues, and those who are frontline and health services staff, to get their vaccinations as soon as possible.
Thank you, Premier McLaughlin. If there are no further questions for members of the panel, I'd just like to remind everyone who intend to walk into the flu clinic at the HSA. There is a schedule that's online on the HSA website that will tell you exactly what times you're allowed to go based on your last name, the first letter of your last name. Also, there's a form, a consent form that you have to download that's also on the HSA website. It has to be downloaded and signed before when you make your way to the clinic. All right.
Donna, one moment. I don't know if you have that information there. There's someone, because I keep checking my phone. I keep getting messages, as you know. What is the website? Do you have the specific website?
It's hsa.ky.
hsa.ky. That's where the schedule will be. That's to the person who just messaged me.
Thank you very much, Premier McLaughlin, and thank you to the public as well as the media for joining us for today's briefing. Of course, to our panelists for all of the information that they brought us here today. A reminder to go online to gov.ky/coronavirus for the latest on the vaccine, the protocols that are in place, as well as any results on a daily basis. Until next time, we wish you a great afternoon.